have you get set up so you can have your knees here, or you can let your legs bend like how you would normally sit in a chair off to the side, just whatever's more comfortable for you. And then go ahead and step forward. Is that comfy?
Mm-hmm.
The height's about perfect, that's not
Yeah.
usually the case. That's where, in real time, you just kind of hold this good and secure, and then you could be unbolting, unclipping, and adjusting. And it's almost always just the face cradle. The chest part I've rarely had to adjust unless somebody's a giant coming in. All right, now showing the pretty much the traditional all arms, using all your arms, you won't look at the shins quite yet, pattern here. It's not too bad. It's similar to the idea of the table. You're gonna have a more difficult time if you stand perfectly in line with them related to like being in the posterior side of their body. If you stand right here and are looking directly at their spine, their angle of your wrist is gonna be trapped more in extension and potential like off in a weird deviation pattern, so it's gonna be more stressful for you to try to apply compressions like this. Even here, you can do an okay job with soft fist. Forearms can work really good, but if you see this is all in the way, and if I'm just gonna kick her feet if I try to come further forward. So, not too difficult to just realize you gotta stand off to the side and either be here on an angle. I tend to be standing in such a way where I'm looking to their right side and I'm working on the right side of their body. I'm looking generally at their left side, I'm working on the left side of their body. The applications are gonna feel better when they start at the spine and go away from the spine anyway. That whole, you see how I look at the wrist angle here compared to here, right? It's a big, big difference to just let yourself off be on an angle. And this ends up being another reason why forever not standing too perfectly perpendicular or parallel with the table is usually the right option. Now, working down to the low back, that's where you're gonna see how do I get there without flexing, right? And if you're standing, it's pretty much gonna be near impossible. Everybody is going to enjoy though, so I make sure I cover the stuff there. Everybody likes the upper trap, levator, scap stuff, right? That classic area where you see the kind of the thumbs and everything. That's going to be a place where you can work really good at multiple angles and have an effect that feels relatively profound. It feels good while you're working on it, and then for sneaky beat, you can include some breathing stuff with all of this, even some muscle energy. The upper shoulders into the neck is where you can genuinely do something here. So, but you're really mostly stuck using your hands. Like getting a forearm into the neck itself is a little bit tougher. The traps will be fine. Thus, part of this is going to be, me showing if you're going to use fingertips, depending on the spacing, like the length of said fingers, the trying to get your middle and ring finger, your third and fourth digits, to be the primary application points. They'll never be perfectly symmetrical. So you're always kind of working on the assumption you have a little bit of an angle here. Just like with soft fist, that's not a flat square, right? So I have to know that actually right now, see how the wrist is nice and neutral, right? I haven't deviated either way. The angle of the chair lends itself very well to that. You just have to be always aware of where you're going to have an angle on the part of your body you're using. Now, with this, it's the bracketing of the fingers and then stacking the fingers so that both are working together. See how it's middle finger over ring finger over middle finger. This is where I can do all that point work if I wanted in any massage situation. And although I'm using fingertips, I'm doing it as efficiently as you possibly could. So slightly flexing and stacking, and then you're in a and in changing up which hand is the top hand and the bottom hand. I typically feel like I am palpating mostly with the one making direct contact and then applying the pressure more with that top hand. So, all right, now everybody, as said, likes their traps worked on. So you might as well make contact with a trap, because you want to keep them stable. There's the ability to shift a bit back and forth in other days. So I usually am trying to make sure, you know, everybody here is a normal size. You have a giant show up, then this starts to feel more topply, right? But they're paying for contact, and I just would always say, why not just at least be holding on to the opposing shoulder and upper trap while working. You can sometimes end up doing, without you forcing it, a bit of a push and a pull, where it'll feel like this is getting some work, but don't make that your focus. Let it just kind of become a part of what's happening here. And it can either feel like both hands are moving forward, but biomechanics wise, just remembering, don't be trying to do that, but both all over, right? Finding your spot.
Yeah. I can't leave my 9-year-old home alone,
Oh,
so I had to take her to grandma's.
okay.
So that's why I'm late.
No, it's okay.
Sorry.
No, sorry. It's a case where the world and weather likes to make things more difficult, right?
I'd get 6 calls an hour, and half of them would be crying.
Yeah. No,
So true. It literally.
family stuff, we're more than sympathetic to, I promise. So right here, I can I can very efficiently and usually to most people's satisfaction spend a lot of time here. This hand on upper trap, this hand between the spine and the scapula, thinking predominantly, you know, middle and lower trap, rhomboids. Deeper to the rhomboids is a sneaky breathing muscle, as I'm just throwing always muscle names at you. So you have 3 serratus muscles.
Did I miss a bunch of this?
Hmm?
Did I mix a bunch of this already? Or did you
You're
guys
just
kinda-
you're here for the demo, and to iterate for everybody again, there's officially a playlist. Has been. I just not sure if I actually vocalized it aggressively. That playlist for fall 2024. That anything I've captured, so you can play catch up and all of it. So yeah, all I mostly was showing was the chair setup
Okay.
and the options. This is the Oakworks chair. I say this one or this one, but you'll all be able to practice on them and try them out. But right here, if anything, let's say, you know, you want to work on more clients, maybe defer to the time frame being more like 5 minutes, maybe 10, but 5 is also sufficient. And you can be mostly just here. Right, you can limit like your workload actually if you just kind of limit maybe the duration and the space you're trying to cover, right? Now, but right here ends up being about as good a crowd pleaser as I can think. It's holding onto that trap and working your way down. Avoiding if there's a strap or anything, make sure you're not digging, you know, a clasp or anything into their body, all that good stuff. Pressure, confirmations, yeah. But always with, I mean, like anything, confirming with a person, just like you would on table. You know, you're gonna get here, I'm gonna try to confirm the pressure's just perfect, not too much, not too little. You let me know at any time, all that kind of stuff. So, but just back and forth. And this will be a good place for you to practice a little bit of this kind of 2-step. I think you can appreciate where being able to go from here to a quick transition, it looks easy, but it ends up being more of kind of a nuance than you expect in this. Be able to kind of cleanly transition from there to there. It's the same kind of mechanic you'll use in some areas of the body of just going this way to that way, right? You're just having to kind of quickly and efficiently be able to switch which foot, which arm. But with that, it's almost gonna always be, can't be here, and here it's like it's a full over to the other side kind of a deal. And I can assess and I can feel, hey, I'm feeling a little bit more tone here in the lower right region of like the probably, what's that feeling? It's probably more paraspinal erector spinae, but that's where I could spend a little bit more attention, all that. So that's pretty easy and complex, not complex. Now, coming any lower than that, that's basically scapulas to neck, easy peasy. Working your way down, one option is to step further to the side and to create the impression, I mean, let's think from a connective tissue standpoint, we're trying to pull everything away from the spine. You're not going to be able to apply a lot of, you're going to be kind of cautious with your force here because it's going to be, once you're here, you're going downhill, essentially. So you want to keep these pretty small and gentle. With this chair, notice how the seat's a little bit higher than that one. So it allows me to not feel like I'm reaching too bad towards the low back. But the element being kind of slippy going that way. So it's worth practicing and seeing if this works. But if it ends up being a case where whatever clothing they're wearing, body, shape and everything, if you're kind of more slippy going that way, then you're gonna have to change up. That's where standing symmetrical like this can work like more in line. The spine can work okay, but if, and this isn't the best angle to be able to see what my wrist is doing. If I try to apply pressure here, no part of the body is naturally squared off. So if everything's rounded here, I try to apply pressure here, my wrist is going to deviate that way. So when you see people doing this, sometimes you can get away with it because between the two, you're kind of keeping your wrist more stable, but all it takes is just, but now we're working right side of the body while I'm standing, looking to the left side. And this is not too bad. The soft fist on your more kind of average size clients can work okay here in the low back. Like pressure wise, we want a little bit more, is that about right?
It's good.
Would that be, we want a little bit more? Or
No,
is it
it's good right
Okay,
side,
it's
yeah.
good, cool.
Yeah.
So kind of more on the sides of the low back. I'm not right by the spine. Like here's the spine, my pressure is starting more over here. So soft fist can work pretty good. Naturally, as shown in the book, you could drop, but my ability to apply pressure at this closer to 90-degree angle on my shoulder is just not efficient for me. Like, you might be able to, but I certainly don't feel like I feel like I have to apply a lot more. And I'm feeling just like how you have to push your heel down, that back heel down to the ground to create that force. Leveraging my knee into the floor certainly is less comfortable, right? So this is an option, don't get me wrong, but I would say I would rather be here, and at least then I can maybe use some counter pressure here with their body, and this will be a bit of a theme. If I can get a hold of an area and use the other hand to stabilize and pull them into me, that can help a bit. The issue can be, you know, you'd have to be using probably more of a chair. A rolling stool in these settings is not going to be too common. So then you just would have to be pretty good at being here. And then scooting that over. It's not the worst thing, right? You just give a scoot, you don't break contact, and then you get yourself set back up and you're there again. But even this, I mean, look at my arm angle. Basically at 90, you can do an okay job there, but you're never gonna get what feels like a lot of pressure delivery. You don't have your body weight helping you as much, so it's always going to be more difficult. All right. But we could make this work. If I start from, let me cover a little bit more, and then we'll do more of like an actual like speed demo. Coming over onto the upper trap and neck area, not too bad here. Perfect place to, because the forearm tends to be less efficient, I mean, at least bring it in here for coming more square right on top of the upper traps. And then that can lend itself real well to even guiding a person here. And you could say, we're just gonna have you lift your shoulder up like you're shrugging, and then down, or you could sprinkle in a muscle energy thing to show off. They have more stuff here than that can be a way to kind of showcase. And I can be a little bit out of the way here. I could have her go out into abduction. We could be practicing our firing pattern assessments and all that if we wanted to. But right here, and a little shoulder shrug. Great, hold. Nice and slow, back down. Reach for the floor a little bit. Good, let go. And a little shrug. Back down, nice and easy. And reach for the floor. Good, let go. I could sprinkle that in, then I could be using this pattern to walk all the way around. And then work on this shoulder and balance that out. The arms, we're good. Okay, we set you. Here, it's always going to be you making sure you're managing how much you're bending, right? So the pulls work okay. The upper arm area, to me, feels by far the most awkward of all, like, you know, at least of working in just like the upper limbs, the arms and the legs are going to be more awkward than working on the forearms or even the calves. So with that, I would prefer to get seated, and for the arms, or down on the knee. I feel like it's a lot better than me just doing it's just gonna be, not gonna feel like I'm getting more pressure into the muscle, you're just kind of spiraling everything around, and that can feel okay, but this kind of counter pressure squeeze, you're not gonna usually be turning this into a need, because you're not using lotion, right? But it's that sandwich idea. And you're getting both sides, you can cover that pretty quickly and efficiently. Now, I could be down on the knee, be about the same there. Once we're to the forearms though, that's not so bad. In the promotional setups, what typically, I mean 90% of it, to be honest with you, was just doing the back and the shoulders and neck, and I wasn't worrying as much about the arms and the hands. However, this, as long as you know this is good and stable, and get myself set. Same thing with the counter pressure, getting a good hold here. The forearms, I feel like you can do a really pretty nice job on. It's a matter of you knowing if you can't or don't want to get down on a knee to have the folding chair. The hands though, that's the thing. You could skip all of this and just go right to the hand.